growth strategy.
Yeah, right.
Okay.
So I mean, you can think about ResMed as having three horizons of growth, right? So you know, if you think about it as this sort of y-axis here is either revenue or, really importantly, the number of patients' lives that we change, right? And those metrics are actually, for a medtech company, those metrics are one and the same. Okay. So, you know, the last 12 months we treated we achieved 1.5 billion in revenues, but as importantly, probably more importantly, we impacted 7 million lives. So then you think about growth over time, and you can sort of think of it as, you know, three horizons of growth, three core parts of the business. The first horizon is sleep disordered breathing, right? That's our core market. We talked about that. That includes obstructive sleep apnea, which is the snoring, stopping breathing, and includes central sleep apnea, which is the brainstem and the lack of ability to breathe with an open airway. And that is a great market. It's growing globally at the 6 to 8% mark, but we beat that. We tend to grow at 10% plus, taking share and growing the market. And there are many initiatives we're doing to drive this. Really importantly, this core market of sleep disordered breathing globally is less than 10 to 15% penetrated. So that means that 85 to 90% of the opportunity is in front of us. So a lot of companies would be dissatisfied with that great market. But we're looking at it and saying, well, why don't we take the great cash flows we get from this and invest in the next horizons of growth? So if you look at this next horizon of growth, this one here I'm going to call pretty broadly respiratory care, right? And that includes COPD, right? It includes neuromuscular disease. It includes ALS, which is also known as Lou Gehrig syndrome, so a lot of difficulty in breathing and neuromuscular diseases and diseases of the lungs. This is all a huge multi-hundred-million-dollar opportunity for us in terms of revenue, but importantly, millions of lives that can be saved. And then the third horizon for us, I'm going to put two elements down on this one, is cardiology and also monitoring. And that can be both consumer and it can be, I'll call chronic disease. Right, so this is a market where, right at the moment, we're running a trial called SERVE-HF, looking at 1,300 heart failure patients and seeing if ResMed technologies can do two things. Here's the outcomes of the study: mortality and morbidity. So we're going to show that we're reasonably confident, or we're cautiously optimistic that we're going to show that we save lives and that we save money for the healthcare system. So as those data come out, which will take, we just finished enrollment in this study, it'll take a couple of years, 2 years or so, for those data to come out. But when those data come out, right, and this is time here, we'll be able to start driving penetration into the cardiology market. And again, heart failure, 5 million patients in the US, another 7 million patients in Europe, more than 20 million patients if you think about the globe. And those patients are really sick and they're very expensive for the hospital systems. They're frequent flyers at the hospital. They come to the ER, the ICU and the CCU. We think we can keep those patients out of hospital, improve their quality of life and improve their outcomes. Similarly, we have technologies that, something the size of an iPhone that I could place here in this monitoring space, and I could read your respiratory rate and your heart rate with no sensors touching your body. None. And we do it through a high-frequency radar. And so if I'm able to read your respiratory rate and heart rate, I might be able to predict whether you're going to go back into hospital, or whether you're going to have a COPD exacerbation event, or whether you're at risk for future obstructive sleep apnea. So this actually links back into the other parts of the business. So these are our three horizons of growth.